Do you love your vagina or do you love someone else's? If so, this video is for you. I'm Dr. Rena Malik, urologist and pelvic surgeon, and in this video, I'm gonna share 10 things that you should never do to your vagina. Number one, don't call it a vagina. Everyone thinks that the only important structure down there is the vagina. It's actually called a vulva, and that includes everything from that hair-bearing area at the top called the mons pubis all the way to underneath the vagina. And that includes so many different structures, namely the clitoris, the clitoral hood, the vaginal opening, the lips around the vagina, and all of them have a very important role to play. If you want to actually review the anatomy, make sure to check out my video about the female G-spot, where I review all the components of female anatomy. Now, if you have a vulva, I strongly encourage you to take a mirror and look down there, follow along while you're watching the video. And for guys, if you're watching this, encourage your partner. Say, hey, let's do this together. It could be a fun and sexy activity where you and her learn together. The other important part of anatomy I want people to know is the clitoris. Now, the clitoris sits above the vagina, above the urethra, and it looks like a little round button. Now, it is essentially the head of the clitoris that you're seeing, just like the head of the penis. The clitoris and the penis are actually homologous structures, meaning that if you look at a clitoris and you look at the internal anatomy, it actually goes deep into the pelvis and forks around just like the penis does. And so it's actually longer than what it appears. And the only thing you see is the head of the clitoris. It's also covered by a clitoral hood. Now, this clitoral hood is just like male foreskin. It can be gently pulled back and it can be cleaned under. Now, some people have really no problems because there's not a ton of foreskin there, but for some people, they develop little debris under the hood and little dead skin cells and oils, and they can lead to just having things like smegma buildup, just like guys do. And sometimes that can scar down and create adhesions between the hood and the clitoris. And this can cause pain, discomfort, or sometimes difficulty getting orgasm. So it's a really important structure I want you to pay attention to. And back to the clitoris, this is the only structure in the entire human body that is just there for pleasure, 100% there for pleasure. So stimulating the clitoris is the most reliable route to orgasm for women. So that was number one and number two. Don't call it a vagina, call it a vulva. And number two, don't ignore it. Number three, don't DIY. And what do I mean by DIY? Don't put things in your vagina that you made at home. So sometimes you'll hear about people doing all sorts of things like putting garlic, yogurt in their vagina. No, your vagina is a self-cleaning oven. And if you put things up there that can disrupt the natural pH of the vagina, that can actually create problems, put you at higher risk for recurrent infections. And that is something you absolutely do not want to do. The only things you want to put in a vagina are a toy that is well lubricated, a penis that is well lubricated, or a medication that's given to you by your doctor. And if you're putting a sex toy in the vagina, make sure it's not something you made at home. You want something that has a handle or a flared base so it won't get sucked up. There is a little bit of natural suction in the vaginal canal, and so if you put something up there that you can't grab onto, it can get stuck up there and very difficult to remove. And we have absolutely seen people in the ER with objects stuck in their vagina having to get them removed, which is not somewhere you want to be when you're trying to have fun with the sex toy. Number four, don't forget to treat it special. Now, you guys have heard about vaginal steaming. That is not what I'm talking about. In fact, I made an entire video about vaginal steaming, and I don't want you to steam your vagina or your vulva. There is no medical benefit to doing it. It is not luxurious. It can sometimes burn you, and that is not what you want to do. But you can absolutely moisturize your vulva. Specifically, when you're going through perimenopause or after menopause, you may notice that things get a little bit more dry down there, and that's because the tissues are changing due to lack of estrogen. And so you can get over-the-counter moisturizers that can be very effective and feel very nice. The vaginal skin is just like any other skin. It can benefit from moisture. And in many cases, you can also use vaginal estrogen. Vaginal estrogen helps sort of balance the pH of the vagina, prevent UTIs, and also helps keep the tissues moist and well lubricated. Definitely talk to your doctor about it, but it is okay to buy appropriate moisturizers and use them when needed. Number five, don't forget to lubricate. Now, the vagina is a self-lubricating organ when aroused, but it needs to be aroused to lubricate. If you are having sex with a woman, you need to realize that it takes time for a woman to get aroused. And if you are the woman with the vagina, you also need to realize that you will not lubricate on demand. You need to actually be in the mood and be aroused. And sometimes that can take as long as 25 minutes. And so I strongly encourage people to realize to allow time for it to lubricate. And if it doesn't lubricate well, that doesn't mean that the person is not turned on. You have to ask your partner, are you turned on? And make sure you're getting receptive feedback that they actually are enjoying what they're doing. If so, use lubricant. In fact, I think everyone should use lubricant. It makes things more slippery, more fun, and more enjoyable. I've talked about lubricants before on my channel. Make sure you check out the video. I even reviewed some lubricants to figure out what might be the best one for you. But lubricant is great. It's so much fun, and it makes sure that things are fun and sexy and not uncomfortable. Number 6, don't forget to play. Guys, the vagina and the vulva are very erogenous areas, right? They feel great when stimulated, but it's important to figure out what works for you. What works for you may not work for somebody else, which requires some exploration. Whether that's by yourself or with a partner, make sure to spend some time figuring out what feels good and what doesn't so that you can either direct your partner or your partner can figure it out for you while you guys are talking and having a good time. Sex is supposed to be fun and playful, but figure out what feels good, what makes you orgasm, what doesn't, and enjoy it because sex is supposed to be fun. Number 7, don't ignore symptoms. So if you have a concern that something doesn't feel right, it's itchy, it's burning, it's painful, or you feel some heaviness or pressure, go see your doctor, see your gynecologist, see a urologist, figure out what is going on because some of these things can progress and become progressively dangerous. Like if you have an STD, for example, a sexually transmitted infection, you can actually cause changes to your pelvis, causing pelvic inflammatory disease, which can lead to infertility. So it is important not to delay treatment. And things like, for example, pelvic organ prolapse. If you feel pressure or like something's falling out of the vagina, that can potentially worsen over time. Now, if it's not bothering you, it's not something you need to worry about. But if you are feeling discomfort, it's important to talk to your urologist or your gynecologist who specializes in urogynecology to identify what are the options for you and how can you potentially prevent this from getting any worse. Number 8, don't be mean to it. Now, what do I mean by don't be mean to it? So one is stress in your life overall can have a significantly negative impact on vaginal health, right? Because if you are stressed, you can't have a normal sex drive. You can't get aroused as easily and you can't lubricate as well, which means that you don't have as much sex usually because you're ignoring it or avoiding it. And sex is actually really important for feeling good, being intimate, being connecting with someone else, and having orgasms, which are really valuable in terms of stress reduction, better sleep, and maybe improving your heart rate and blood pressure. And so there's lots of value in being intimate with another human being or with yourself. And stress can cause your pelvic floor muscles to tense up. That's that bowl of muscles that sits in your pelvis that supports your bladder and your rectum and your uterus and also is around the vagina. And so when those muscles tense up, people can start having a whole host of symptoms. Things like bladder pain, things like pain when you urinate or defecate or have a bowel movement. It can cause pain with orgasm. It can cause pain with sex. So when someone tries to enter the vaginal canal, whether it's a finger, a toy, or a penis, it can cause pain and discomfort. So it's important to sort of minimize stress. And if you're experiencing any of these symptoms, to please see a doctor. And number 9, don't forget to diversify. Now, what do I mean by that is when you learn to self-pleasure, a lot of people tend to self-pleasure the same way every single time. And that's usually fine. However, some people get habituated to that type of stimulation. So for women, oftentimes it is a vibrator or some sort of vibration, which cannot be replicated by a mouth, a finger, or a penis in any way, shape, or form because it does not vibrate at such frequencies. And so sometimes you might find that it's a lot easier to orgasm, or maybe you can only orgasm with vibration or with a sex toy and not with your partner. So it's important to sort of diversify. Sometimes use your hands, sometimes use fantasy and other ways to help yourself orgasm rather than just always relying on vibration. But if you are fine with it and you get great orgasms with vibration and you're still having great orgasms with your partner, don't worry about it. If you're in the situation where you are easily able to orgasm through self-play, but not with your partner, and you're okay with it, you can also bring your toys into the bedroom. Have your partner be a part of that stimulation. Number 10, use it or lose it. Now, I don't want people to use this as an excuse to force people to have sex, right? I think it's important important that you understand what I mean by use it or lose it. So what I mean is that in many cases, just like we see in men, if you don't continuously have good clitoral blood flow. And that usually happens at nighttime, even if you're not having sex, because your body is creating good blood flow to the clitoris. It's getting engorged throughout the night and even in the morning sometimes. And so you're getting good blood flow all the time. Now, if you are unhealthy because you don't have good blood flow because of high blood pressure, diabetes, high cholesterol, and that's affecting blood flow to the clitoris, over time, it can become more and more difficult for the clitoris to get engorged with blood, meaning that your arousal or that feeling of being turned on can get diminished over time. And so it helps to then make sure that you're constantly getting blood flow to the clitoris. And the easiest way to do that is to have sex or to stimulate yourself and get yourself turned on. Now, if you are an overall healthy person, blood flow is getting down there no matter what every night. So you don't absolutely have to have sex. But if you are unhealthy, then it's very important to fix those health factors. So improve your blood pressure, fix your diabetes, improve your cholesterol so that you continue to have good blood flow. What happens is if you lose blood flow to that area for prolonged periods of time, many, many years, then you can notice that scar tissue builds up in those tissues, meaning that again, it becomes more difficult to get aroused. All right, that's it. I hope you guys found this helpful. If you enjoyed this video, make sure to sign up for my newsletter at rinamalikmd.beehive.com and check it out because each and every week I share new research that will help improve your life as well as answering a subscriber question and covering what's going on with me lately. It is completely free and I promise you're going to enjoy it. And as always, you're going to take care of yourself because you are worth it.